for full-time active duty. So what that looks like is over $7,000 without dependents. So if you do have a spouse or children, it's a little bit more. So annually, that's a little over $29,000 you get just extra. That's not including what they're already paying for your school, your books, and everything. So you see there, if you get 4 years, it comes to a little over $117,000 for the entire time that you're in school. So it's a pretty good deal if you can get it. It is hard to be selected. We are pretty competitive, but it's a wonderful program for sure. The advantages of being a dentist in the Air Force: every year, you have to continue your education. While you're in the Air Force, we send you to do that for free. You're not missing any time. You're not losing seniority. You're not losing pay. It's all paid with benefits full time. No overhead costs. What that means for you is you're coming into a ready-made practice. So you don't have to worry about leases, payroll, training. The people that have been working there as techs have been in the Air Force for years and are already trained. So when you walk in, everything's fully running. You just get right to work. You don't have to worry about that. No malpractice insurance. Again, that's money in your pocket that you don't have to worry about paying out later on. No HMOs or insurance companies. Everybody in the Air Force, we are all covered for dental, us and our families. So you never have to worry that you're not going to get any money, or you can only see so many patients because you have to get the money coming in. You don't have to worry about any of that. If you give the patient kind of the continuance of care that you want, you're going to see that happen. If you tell them that they need to go and get something done, they have to do it, or else we can get in trouble for not following orders, because not only are you a dentist when you're in the Air Force, you're also an officer. So I said, when you start the school, you're a lieutenant, but once you graduate, you're a captain in the Air Force, and so as soon as you go to your first base, you go as a captain. Also, you may not be something you're thinking about now, but you do get a 20-year non-contributory retirement plan, which means that after 20 years of service, if you decide to do that much, you get a retirement right away. If you decide to stay in longer and your rank goes up, then your retirement will increase. Also, we have small, medium, and large practices, stateside and overseas, so you kind of get a little bit of everything. You may be stationed at a base where it's a small clinic, there's only a couple dentists there, or you may be stationed at a big clinic like at Travis up in Northern California, which is also a training hospital. They have residencies there, so you got a little bit of everything. Leadership and advancement, if you decide that there's other things you want to do that you want to practice, but maybe later you want to take more of a leadership role so that one day you can open your own practice and have the experience needed to do so, you can do that as well. We have commanders that go through and lead the entire dental clinic. Sometimes you could end up being in charge of an entire hospital, because at that point it's not based on what your job is, it's based on what your rank is. So you could be the commander over the entire hospital, all the doctors and nurses and dentists, just depending on where you're at and what you're interested in. Also, AGD programs. We do have our own AGD programs, 1 and 2 year, as well as we will pay for you if you want to go to just any AGD program like you normally would. Same thing with residencies. We have all the residencies that you have on the civilian side, as we call it. So those are available to you as well. Also, as I was saying, if you did decide that you wanted to teach someday and you were residency trained, you could go and teach in those residencies. So the possibilities are endless. Really, it just depends what you want to do and how far into your future you're looking. And as I said, the opportunity to specialize is there as well if you decide that you do want to go into a residency. Another big benefit, humanitarian relief. I saw that you have sign-ups there for doing dentistry overseas. That's something that we do as well. Of course, we like to go out and help those that are in need, and you have the opportunity to volunteer for that if that's something that you're interested in, and kind of get training that you would never get anywhere else. Commitment for dental scholarships. If you do get a 4-year scholarship, what that would mean is for you, usually before your 4th year, when you are starting to apply for dental schools, that's when you want to start the application process with us, because it is kind of an intensive application process, and you never know what can happen along the way, so you want to make sure that we have everything ready. The boards are usually in February, and you don't usually get that acceptance letter until December or January, and that has to be in the application. So we want to have your application fully ready, so that once we get that acceptance letter, we put it in there, send it off, and you're at the board. So that's for the 4-year. For 3-year, usually that would be now people who are in their senior year right now. No, sorry. No, I'm working with seniors right now for the 4-year. The 3-year usually is if once you start dental school and maybe you either didn't get accepted for the 4-year or you get there and you realize it may be a little bit more than you thought, so you'd like to try to get the benefit of having your school paid for you, then you would come to see us about the 3-year. At this time, we don't do 1- or 2-year scholarships. So what that means for you as far as commitment, if you get a 3-year scholarship, then you would serve 3 years back in the Air Force. If you do 4-year scholarship, then you serve back 4 years. So it's year for year commitment. The minimum that you serve would be 3 years, but after that, it's up to you if you want to re-enlist. You know, if you get a position where you're enjoying it and you really want to continue with it, then you can do that. As I said before, with the AGD, if you did do an AGD 1 year, then that would again be a 1-for-1. So if you did 4-year scholarship and 1-year AGD, then you would go 5 years back. So everybody has to be board eligible and certified once you complete dental school. For training, as far as training, you don't have a basic training like you would coming in out of high school, like you see on TV with the TIs and everybody screaming at you. It's more of a professional setting. Everybody, this is called commissioned officers training. It's all doctors, dentists, lawyers, and chaplains, so it's more professional. They're still going to give you a taste of what basic training would be like, so you can have that experience. They're going to teach you Air Force history. They're going to teach you kind of what being an officer means to you and leadership, so they're going to focus on that. But it's only 30 days, and like I said, it's not as intense. I mean, you're not going to be crying and calling home. It's not that bad. So if you do 4-year, you actually would go to COT the summer before you start dental school. If you do a 3-year, you won't go until after you graduate because we're not going to break up any of your dental school time. While you're in school, we want you to fully be focused on school. Okay. Basic qualifications. To be an officer in the Air Force, you have to be a U.S. citizen. You have to complete your undergrad degree and have at least a 3.5 or higher. Your DAT needs to be an 18 or better, and then we also look at just things we look at for everybody coming into the Air Force: no drug use, no major law violations, no major health problems, things that would hurt you like asthma or a serious health condition that you wouldn't be able to serve. And then you have, like I said, that acceptance letter. You have to be accepted into a dental school. So before I finish, I just want to say I put one of these in front of everybody. So what it is, my business card, just a pamphlet of information, and then if you could please fill this out, and then at the bottom you just say yes, you're interested, or no, you're not. And if you're not, I won't be emailing, calling you. I may email and say thanks for coming and having us, but that's about it. And then we'll pick those up and take those with us. So this is just informational for us. But most importantly, if you don't mind signing in so that we can get reimbursed for that, we would appreciate it. So this is me. All the health professions recruiters were all together in LA, kind of closer to UCLA, off the Santa Monica Boulevard and 405. So I do dental and medical core. We also have allied health, med school, kind of everything, nursing, all rolled into one office. Does anybody have any questions for me?
You said that after you serve about 3 years and 4 years, you would choose to stay. Is there like a contract for how long you would stay after that, or is it kind of like, I want to stay, so I'll stay?
No, every time that we re-enlist, we re-enlist for 4 or 6 years.
Okay.
Sure. Does anybody else have any other questions?
If someone were to get into specialties after dental school, what would that look like?
It would depend if you're going to go to a residency, a civilian residency, or if you were applying for an Air Force residency, and that would factor in. So if you went to a civilian and we were paying you for that as well, then it would be the same year for year.
And then they go back to the school.
Right, residencies are a little bit different. We don't do scholarships, we do financial assistance, so we kind of give you an annual salary while you're going to, $45,000 annually is what it is right now, and then another stipend. So it's a little bit different. Scholarship, we're paying directly to the school, but with the financial assistance, it's going straight.
Even though you don't do school, that's your top.
Right, because we're still paying you. We're pretty much giving you a salary while you're in there.
Thank you.